Write your name in chat box. I'm not seeing us. We have 10 people here with us. Just tell us where you're joining us from. Can you hear me? Okay. Just
Yes, yes,
write your name and tell us where you're joining us from. What
yeah.
country, location, just tell us.
Okay.
Okay. So I would like the welcome address. I would like the welcome address to be taken by um, the president of the network of the African Digital Health Professional Network. Is she here with us? Esther, are you set to take the welcome address?
Hi, good evening. Can you hear me?
Yeah, we can hear you.
All right.
Yes.
Thank you so much. Nice to meet everybody and welcome again to July webinar. Um, my apologies, I would have loved to turn on the camera so you can see my face, but I'm unable to do that currently. So you just have to bear with me and just listen to my voice. But all the same, I welcome you to this webinar. Thank you so much for joining in, and I'm sure that we are going to have a good time. So the essence for organizing things like this really is to be a platform where we communicate with one another. We foster shared learning. We learn more about this field of digital health, and as professionals who are working in the field, enthusiasts, whether at different levels of our career, from early to late to like experts, and all of that. Basically, rub minds together, learn from experts, from people in different sectors, in different areas, from different backgrounds and from different countries, where they can then help us, to increase our capacity. And so we take all of these learnings, we take it back, we apply it to our work, to our own career development, and ultimately contribute to improving the digital health landscape in Africa, right? And of course, by inference, the health outcomes of people and communities in Africa as well. So I will not take so much of our time, but I would just want us to sit back, relax, enjoy as much as possible. Our expert here today has a lot to share with us, and we are also ready to learn from him. Um, so thank you so much for joining us. And I'm taking that to our guest. Thank you so much for honoring our invitation and obliging us to share from your wealth of knowledge. And this topic is actually something that is very, very important, because we have a lot of solutions out there. We have a lot of things around health information systems, but it's not just about having them hanging around. It's really about how well we can effectively implement, optimize them, and also that we can enjoy the benefits of having them in the first place. And then hopefully we'll see areas that we can pick and learn from, right? And then, apply within our own immediate environment, communities, adapt within our own countries, use that to make recommendations to maybe key stakeholders around us, whether in the private or public sector, and generally be able to contribute to the betterment of our communities. So thank you so much once again, and I'm going to hand over the mic um, back to our anchor for today, our programs officer, and then we would go on and continue with the webinar. If you have questions and all of that, I would encourage us to note them. You can drop them ahead in the chat box, so that we can, our people can, go through and then compile them. And also when it's time for question and answers, we will then be able to throw the floor open as well, so that we'll be able to learn further. Thank you again, once again. And Emmanuel, over to you.
Okay, thank you, Madam President. Let's give her a clap. Give us an emoji of clap. Let's appreciate our president. She has really stewarded the leadership for this network in the past few months, and we are really grateful for the inclusive and the visionary leadership you've provided us. Thank you, Madam President. So over to our speaker. I would like to read the um, the citation of our speaker. Our speaker has a bachelor's degree in computer science, a master's degree in earth informatics, and is a PhD candidate in earth informatics in the University of South Africa. He has over um, 15 years experience in the earth sector and has been involved in different health information system designs and implementation in Ethiopia, such as the District Health Management Information System 2, the EMR, that is an electronic media record, and electronic community health information system in Ethiopia. Currently, he works as the senior data use advisor and gigs coordinator in ACAP Ethiopia. Join me in welcoming our speaker as he takes the lead. Yeah, thank you so much. It's good to have you here, and we can't wait to learn from your wealth of knowledge. Yeah, over to you, sir.
Thank you very much, Madam and Mr. Emmanuel, for just coordinating this interactive webinar. And then I really appreciate, your contribution in terms of providing an orientation for low and middle income countries like Ethiopia. So thank you, really appreciate that. So by saying that, the title, as already it's mainly about. Can you hear me? Sorry, can I just proceed? Yeah, effective implementation and optimization of health information system. In terms of, I'm just main focused on the low and middle income countries like Africa and in East African context as well. So by saying that, next slide, please. Can I just share from my side or? Yeah, thank you. So my presentation outline is mainly on, it deals with the background, the definition was health information system, components of health information system, HIS implementation in low and middle income countries, HIS optimization. Finally, we come up with challenge and recommendation of the HIS entire implementations. Next, please. So when we just come to the background part, according to WHO in 2012 and major evaluation, we can just simply say the health information system is a system that designed to manage healthcare data that start with data collection, process, analyze, store health and health-related data to support quality of health service delivery and patient care. So that means mainly the data as indicated with the service delivery we have. So HIS is not the end goal. The end goal or the ultimate goal is improving health service delivery and creating a satisfactory health patient care, quality of patient care. That is, an enabling environment to achieve a certain goal in terms of just, improve the performance of the entire health service delivery. So by saying that, next slide, there are six components of health information system according to major evaluation in 2023 and WHO Health Matrix Network Framework in 2008. So it is related with most of us, input, process, and outputs. So we need to just think about when we have an input, we need to just process it, and then we expect some outputs or products. So in terms of just that category, there is HIS resource, which considered as an input. And then we have also three key components: indicator definition, data source, and data managements are falling under the process. and the outputs is related with the information product and communication, dissemination, and use are categorized as those 6 components are HIS under the HIS component. So next, please. So the other one is when we need to just think about deep dive about the HIS. The foundation part is the HIS resource. So under the HIS resource, this is a kind of foundational part, or we can just think about this is HIS governance. So when we just think about that one, each countries need to just think about creating a legal framework, regulation, legislative, planning frameworks, and resources that support the implementation of HIS is a key factor. So can you hear me? So yeah, the key factor that contribute to the HIS resource. So we need to just think about the personnel that support the HIS, the finance or resource, logistic support, information and communication, digital health tools, ICT products, and a coordination mechanism falls under the HI resource. So the HIS resource is a prerequisite in order to just initiate the health information system implementation. So when we just contextualize this thing, we need to just think about the tally sheet we just provided to the health centers or the health facilities, the digital health solutions that facilitate the health information systems, the financial adequate financial support is required, and the personnel that manage the data or the data managers need to be capacitated. Next, please. The other component is the indicator definition. This is, a set of indicators that track the performance of health system, that track the performance of health service delivery, and that tracks the outcome, the entire outcome of the health system. So that is mainly fall under, we need to just consider clear definition of the indicators, the formula we have, the interpretation of the indicators, the disaggregation level. Some of them are like male and female disaggregations. Some of them are, age disaggregations. Some of them are, facility level disaggregations and the like. In the data source where the data is collected and the frequency, the time when data, that indicators need to be collected should be clearly defined before just start implementation. The other one is HIS data source. As most of you know, we have 2 data sources under the HIS. One is a population-based data source, and the other one is institutional-based data source. Those institutional-based data source are, manage, we can say, routine health information systems. Like the HIS2 is one of the platform we used as routine health information system. Electronic medical record is the same. And the other population-based data sources are census, civil registration, and population surveys are fall under the data sources. So we need to also think about a clear and demarcated data source, and where it is collected need to be addressed. The data management is also a key component of the HIS. So that is mainly think about the data handling, how it is collected, and how it is stored, how the data quality assurance mechanisms handled, how the data flow or the process or the flow is gone through, and the compilation and the analysis need to be categorized under the data management. So the data privacy, confidentiality, we need to just secure our data, like in order to just protect unauthorized user access and disclosing patient level data. And the data quality also one of the key aspects of this data management. So when you think about the data quality, we have to think of, we don't have a perfect data. Yes, we have to just make sure that our data need to be accurate enough, not perfect enough. We don't have a perfect data, but we have to think about our data need to be accurate enough, timely enough, and consistent enough all over the organization, or starting from the lower up to the national level of the health system. So this is the data quality dimension. So we have to just keep the data accuracy, the data reliability, the data completeness in terms of two things. One is content completeness, and the other one is representative completeness. Precision and timeliness is a key aspects of the data dimension. Next, please. Sorry. So when you think about the information product, next, please. Sorry. Next slide. Next slide. Yeah. This I just already presented. Next slide. Sorry. Yes. This one is the data dimension part. Yeah. Thank you. So when we just think about the information product, every data needs to follow this cyclic process. Yes, we have data. We need to just convert into information. And then once we have information, we have to just synthesize. We have to apply different mechanisms. We have to interpret and evaluate the data, and then we have to come up with the evidence. And then once we have an evidence, we have to just also create a knowledge. And then that knowledge needs to be transformed into decisions. Those decision makers have a lot of and easy to be understandable and then impactful information product need to be produced. Once we have a better information, we have a better decision. And once we have a better decision, we have to have also a better health. So in order to just communicate those products, we have a different mechanisms need to be shared across the entire health sectors. So one is a publication. We have to produce quarterly bulletin, monthly data, weekly data, and daily reports in order to just compile that thing. And then we have to also think about research related products. We have to just formulate a kind of strategies based on the data we have, and then share to the other stakeholders and partners. Those are mainly on decision makers. So next slide. In addition to information product, we have to also think about dissemination and use. So we have to think about our programmatic area aspect in order to effectively utilize use of data for performance improvements. So one of the things is those data need to be reliable and need to be easy understood by stakeholders working in the health sector, decision makers, politicians, and other partners that contribute to the health sector need to be addressed in here. So one of the things is program design and strategy need to be addressed or based on the data we have. And the data decision need to be made based on the program service delivery. So if you need to, open new service in the hospital, or if you just, introduce new programs in the health sector, we have to just have a data, and then we have to use based on that data we have and allocated resources. In general, we have to use of data for decision making, for planning, for budget utilization, for service enhancement, and for performance improvement need to be addressed in dissemination and use. So those are target audiences. Majority of them have to be addressed in public sector. So the public needs health information. So we have to just provide, public orientation related data. Those are very small and minimal. So politicians need data, so we have to address them. And academic research and institute agencies need to be addressed. So those platforms are, some academical methodologies need to be applied. So we have to think of peer review journal articles, research databases, oral and poster presentations. So programmatic related data, or program managers and decision makers also require data for their decision making processes. So monthly, quarterly, weekly data are a key to use the data for their own performance improvement. So we need to just think about those are the key actors that use data in HIs. So when it comes to implementation of HIs, so we have to think of these 8 steps according to WHO 2000 HMN framework. So one is we have to regularly review our existing systems and identify if there is a challenge. We have to resolve those challenges in collaboration with stakeholders. The other one is define data needs and data demand across the health sector. Once we define the data need and data demand from the program side, so all the programs need to be engaged, appropriately defined, effective data flow based on the actor we have, based on the audience we have. And sorry, next slide. Slide for number 14. Sorry. Then the other one is we have to design a data collection and reporting tools. In addition to that, we have to also define a clear procedures, mechanisms for data processing. Not only that, we have to also develop implementation manuals and training materials. And we have to think about pilot testing in a small phase and think about a kind of phase-based approach, iterative related approach. Agility is required. And finally, we have to measure effectiveness and efficiency of the health information system. Finally, think about scale up. Before just going to the factor affecting for the effective implementation of health information system, if you have anything else, I will address, or we can just, at the end, we will have a kind of discussion and, question and answer session. Can I just proceed? Sorry. Can you with me? Sorry, can you hear me?
Yes, we can hear you.
Okay, can I just proceed?
Yes, you can.
Great. So key factors for effective implementation of health information systems are 8. One is strong leadership and governance is highly mandatory. The other one is stakeholder engagement. So we have to just identify key stakeholders and engaged appropriately. Not only stakeholders, we have to also think about partners closely working in the health sector and allocate adequate resource for the implementation of health information system. We have to have a clear goal and objective in a kind of phase-based manner. And user support and training is very critical. Standard and interoperability is also a key. Monitoring and evaluation. Finally, continuous improvement is a key factor that improved the implementation of health information systems. Those are the key factors that contribute a good health information system. So according to WHO, almost WHO recommend currently the use of digital health solutions as part of health information system is very critical. So without digital health solutions, even the investment we have is not, adequate enough, and the data we generated in health information system is highly costly, and quality of data is also less. So according to that, WHO major components and area of interventions were defined in terms of health information system. One is personnel information, which is related with patient level data or the national ID projects, or we can say social security ID related systems. Insurance related data need to be addressed, or we can say social health insurance and community-based health insurance. Medical information systems need to be also addressed as part of health electronic health record. So the medical information system by default is electronic medical records, radiology information system, laboratory information systems, administrative and billing or financial information systems, and patient demographic data and content level information system need to be addressed as part of the health information system. And digital tools are a key or a foundation to improve or to optimize the current health information system. So next slide, please. Next slide, sorry. Next slide. Next slide. This is also already presented, sorry. Yeah. In terms of optimization, next slide, we have to use a SOCI framework, which is developed by Measure Evaluation, currently working in low and middle income countries. So this started with HI strengthening model. So as I said before, HIS is a means, it's not an end goal. So our end goal is improved health system and improved health outcomes. So by through continuous improvement on health information system. So there are different components which go through this picture. One is HIS governance and leadership. The other one is HIS management, data management, information product and dissemination, data use and data quality. Data resource or data source are the key milestones that contribute to the improvement of the entire health system in the health sector. So by saying that, those are the, what I said before is the components of health information system. And then once we just regularly assess, we just categorized our health information system into 5 stages. One is emerging, which is, it tells you about the fragmentation of health information system, fully paper-based system, the capacity of health personnel, the capacity of data managers at a lower level is not yet capacitated, and it's not even nationally scaled. We can just, those characteristics are categorized into emerging. Then we jump with repeatable. Repeatable is more, categorized as a kind of standardized processes, existing process based on the previous activities. When you think about defined is, we have a kind of approved and documented system that support the entire health information system. Managed is related with those implemented nationally information system, which is also aligned and interoperable. Optimized is related with best practice applied health information system, which is capacitated in the entire scaled health information system and collected feedback from the programmatic areas. So those are categorized, and that will help us assessing regular and in terms of just stage-based continuous improvement assessment tool. So next slide, please. The next slide talks about a key components of the SOSI framework, so staging of continuous improvement framework toolkit, which is developed by Major Evaluation and then currently implemented in low and middle income countries for the sake of improving their HIS implementation. So those are the key categories, and then almost majority of HIS leadership and governance is a core component, and under subcomponent we have HIS strategy, policy, regulations, and compliance related issues need to be addressed in the HIS governance. Under the HIS management and workforce, the financial adequate financing of the HIS and HIS or health information system, workforce capacity development, and optimization need to be addressed under the HIS management and workforce. Under the HIS ICT infrastructure, we have to just optimize the business continuity. We have to think about the continuous communication and networking of systems, digital health tools, operation of and maintenance of other digital health tools need to be considered as part of the HIS infrastructure. And the standard interoperability also a key. As most of you know, in Africa, we are suffering a lot on fragmentation of health information systems and digital tools. So we need to just come up about standards and interoperability in order to just improve the data exchange among digital health solutions. So the HIS core services, interoperability, data exchange, standard guidelines need to be addressed. So ultimate goal of under the entire HIS is improving the data quality and data use. So we have to continuously assure data quality assurance and apply the other data management tools, and data availability and data use process and products are the key. So next slide, please. So just to say something about experience of Ethiopia, the previous slide, sorry. Experience of Ethiopia. Ethiopia introduced the Information Revolution Roadmap as part of the National Health Sector Transformation Plan agenda. So that mainly addressed, the ultimate goal of the health sectors within every 5 years. So Information Revolution Roadmap has 3 key pillars need to be addressed. One is cultural transformation towards health data use. The other one is digitization and scale up of priority health information system. And the third one is strengthening health information system governance and leadership. So based on that structure, Ethiopia has improved different by applying different health information interventions. We have at the stage of optimizing things. So that is a key factors. We need to just introduce clear strategy in order to just achieve a certain goal. So next slide, sorry, next slide. Yeah, thank you. So the key steps to optimize HIS is we need to just think about a framework, or we have two frameworks. We need to just collaborate and customize those frameworks and apply to optimize the health information system. So one is the International Public Health Foundation framework in order to just improve the public health performance. And the other one is performance management framework for performance-based incentive, which is applied by Living Goods and as part of the community health workers, which is designed in 2023. So those both frameworks are acceptable and recommended by WHO. So when we just think about this thing, one, we have to set a standard, performance standard. So we have to set HIS standard and think about a kind of phase-based approach, we have to start with a small and we have to think big. We have to target a big thing. So the other one is, after setting HIS resource, we have to also set standard indicators with a clear target. So as I said before, HIS is introduced to improve or to support the entire health system. It's not an end goal for the health sector. So those indicators are a guiding or a litmus paper to track the performance of the entire health system. So we need to just think a set of standard under the indicator. So the other one is, we have to have a clear data source. We have to have enough data management tools, procedures, information product focused on dissemination use and use are the key under the performance standard. Once we define a performance standard, we have to have a clear measure indicators in terms of formula, in terms of definition, in terms of where the data is collected, in terms of frequency, in terms of implementation area, in terms of just geographic categories. We have to just customize those standards and apply based on contextual things. For instance, in Ethiopia, we have, federal system and then different language, and not only language, different cultures. We have to customize, like when, for instance, our health system is categorized into three. One is pastoralist context, the other one is agrarian context, and the other one is urban context. We have to just contextualize our health information system standards and apply it. The other one is performance improvement. So under performance improvement, we have to just think about digitally enabled tools like digital health systems, DHIS2, electronic medical record, telehealth system, mobile health systems, electronic community health information systems, and others need to be considered as a facilitator, as a means to facilitate data from the lower level, from facility level up to the national health information systems. So that will facilitate information use, that will improve the data quality which is generated at the point of care, and different level of the health systems. So we need to just think about digitally enabled tools. The other one is ECOOP. ECOOP is referring with one, training and capacity building. So we have to just provide enough training for data managers at a lower level. We have to just provide training for public health professionals. We have to just provide training for decision makers that use the data. And the other ECOOP is, we have to just think about functionality of the HIS inputs, computers, equipment, tally sheets, registry, reporting tools, and others. In addition to that, we have to also think about supportive supervision and mentorship. Yes, we just provide inputs. Inputs by itself is not enough. We have to just provide supportive supervision, one, and mentorship for based on the identified gaps. And then almost majority of the health systems is neglected this thing. Performance-based incentive is a key and driving factor to improve our health information system implementation. So applying performance-based incentive for health professionals, for health data managers, and decision makers are a key, and that will also improve the data quality. That will also contribute to the facilitation of use of data for decision making at facility up to the national health information system. Finally, monitoring learning progress is a key, because those are an enabler just to reinitiate again. That will facilitate improvements, monitoring things, and learning progress are a key to improve or optimize. Those are a key steps to optimize our health information system. Next slide, please. Sorry, next slide. Sorry. Next slide. This is the architecture we have, but I already presented. Yeah. The HIS challenge is a key. Next slide. Challenge and recommendations. So when you come to the challenge, we have to just categorize into three. One is behavioral related challenge. The other one is organizational related challenge. And the third one is technical related challenge. One, as part of behavioral, poor awareness and attitude, knowledge and skill among HIS. Majority of health professionals, especially, they just focused on the service delivery and provide services at the lower level, and they didn't focus on the data they have. So we have to just provide a kind of awareness and motivate them in order to just improve, synthesis of the data, generating the data, and use the data by their own, and improvement of by their own, in terms of just improving their own service delivery. And low motivation among data managers. Yes, data managers are, highly burdened and triangulated data. So you have to motivate them. The other one is organizational related issues, HIS team, structure, functionality, limited investment on management of HIS. Majority of the HIS or health information system, or we call it digital health systems, are partner driven, especially when you come to Africa. So we have to just invest progressively, and we have to have a clear role and responsibility among health professionals, data managers, and decision makers. And low attention of information use culture is organizational related challenge or issues need to be addressed. When it comes to technical related issues, lack of integration on routine health information system design and less maturity level is a key challenge on the practice of health information system. Next slide, please. Yeah, when you come to recommendation, which is my last slide, as a recommendation, providing awareness and increase attitude, knowledge, and skill among health professionals, and strengthening the performance-based incentive among data managers and other health professionals is a key that motivates, data managers as well and other health professionals. Establish and strengthening the HIS functionality, strengthen technical working groups and other HIS governance and leadership, and design and approve a clear role and responsibility of HIS experts in the health system, and strengthening information use culture in phase-based approach is a key. As final recommendation, strengthening the integration of routine health information systems, design and implementation. As most of you know, our health information is partner dependent, and we do have a kind of immunization routine information system, maternal health routine information system, and a kind of fragmented system. So we have to have a kind of one routine and aggregated integrated routine health information system that facilitate the performance of health information system, and routinely apply and test the maturity of health information system, and apply corrective measure in the entire health information, the entire health system is a key. So by saying that, I really appreciate and thank you all. Next slide, sorry. Thank you all for your attention. And if you have anything else, I will address it. And thank you very much. Really appreciate. Thank you. Over to you, Haruna.
Thank you, Mr. Wadwonson Shufaro, for the insightful presentation. Now we'll be going into the question and answer segment, or rather the contribution segment. So if you have any question, you can raise your hand and you'll be given the permission to speak, or you can input your question in the chat box. And again, I would like to share an attendance sheet on the chat box. Kindly help us fill in the Google Sheet so that we can have the information. Thank you.
Thank you very much.
Any question?
Hi,
right.
Vincent seems to be raised.
Thank you, Program Director. Can you hear me?
Yes, I
yeah.
can hear you.
Oh, well, thank you. Thank you, Wanda, for your presentation on the use of health information systems within within the health system, the broader health system. I'm coming from South Africa, based at the University of South Africa, so mine is a remark more than a question as such. I would like to first of all pass my greetings to you all from us here in South Africa and from our eHealth Colloquium, of which Wanda is
Yes.
also a member.
Yeah.
So good evening to you all and greetings from our group.
Yeah.
Wanda is our student at UNISA.
Yes.
And there he's indeed doing a study on routine health information systems, and he's doing quite well in his study. He's already submitted all the beginning chapters, right? That's a literature review, a methodology, as well as the results. So congratulations, Wanda.
Thank you.
On that initial step towards
Yeah.
finalizing your thesis. Of course, we must provide review, Chief, and then after review and update, we can ready ready your thesis for submission. In terms of the presentation itself, right? Wanda early in the presentation says that data is not perfect, right? The data that is collected is not perfect, and indeed, right, that is the situation. But there's also the counterpart, right? The data collected, but there's also the usage of the data itself in decision making. I can also say that is also not optimal or perfect, right, within the health system in general, right across the continent. One study delves into that issue of use of data in decision making, and the issue of the culture of use of information systems, and these results are very interesting. and shed a lot of light, and will come up with good recommendations. And also he offers gaps going forward in this endeavor of ours of e-health on the continent. Congratulations again, Wanda, and thank you, Program Chair, for the opportunity to contribute. Thanks.
Okay, thank you so much for the contribution.
Yeah.
Mr. Vincent, you can continue, please.
Yeah. Can I say something? Sorry.
Okay.
Sorry. Dr. Vincent is my advisor. I really also appreciate his contribution as well for this audience. So that's what I want to say, and really appreciate his contribution as well in terms of just coming this kind of framework and things. Over to you, Aruna. Sorry.
Okay, Mr. Vincent, you can ask your question, please.
No, thank you, Program Chair. That was the remark that I had, or the remarks that I had. Thanks.
Okay. You're welcome. Please, do we have any additional question now?
Is there any other question, contribution from anyone?
Okay. In the absence of no questions, I think we can draw the curtain for tonight. Thank you so much, Mr. Woodwinson, for honoring our invitation, and everyone that partook in this discussion. Kindly help us fill in the Google Sheets before logging out. Thank you once more. Good night.
Yeah. Have a good night. Thank you very much.
Bye. Thank you.
Thank you. Thank you so much.
Bye. Thank you.
Goodbye, everyone. Bye-bye.
Goodbye.
Thank you. Bye-bye.
Good night, everyone.
Good night, everyone.